Welcome, everyone. Thank you so much for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General Hospital. Today's program is part of our Climate Change and Health series, which is a special collaboration among the Blum Center, the MGH Center for the Environment and Health, and the MGH Institute of Health Professions Center for Climate Change, Climate Justice, and Health. Before we get started, I just want to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Please note that you are in listen-only mode. Everyone has been muted so they can hear our guest speakers today. If you have any questions for our guest speakers, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them in the end. Only Blum Center staff and our guest speakers will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the conclusion of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. All right, so next I would like to introduce you all to our guest speakers. Joining us today, we have Dr. Patrice Nicholas. Dr. Nicholas is Distinguished Teaching Professor and Director of the MGH Institute of Health Professions Center for Climate Change, Climate Justice, and Health. She is also the co-director for policy and advocacy of the MGH Center for the Environment and Health. She teaches in the Doctor of Nursing Practice program and advises accelerated Bachelor of Science in Nursing students at the MGH Institute. She also serves at the MGH Center for the Environment and Health on behalf of the Department of Nursing and Patient Care Services. Joining us today, we also have Dr. Suellen Breakey. Dr. Breakey is Distinguished Teaching Associate Professor in the School of Nursing, as well as an Associate Director of the Center for Climate Change, Climate Justice, and Health at the MGH Institute of Health Professions in Charlestown. Her clinical background includes global health and critical care nursing. Dr. Breakey teaches in the Doctor of Nursing Practice and accelerated BSN programs with a focus on ethics, evidence-based practice, and population health. As part of our Climate Change and Health series, they join us today to give a talk on vector-borne diseases in a climate-changing world. So please join me in welcoming Drs. Nicholas and Breakey.
Thank you, Amy. It's a pleasure to join you for this Climate and Health series. For those of you who joined last week when Dr. Breakey led the session on heat-related illness, we know that heat-related illness is a very timely topic with what we've experienced this past week in Boston, and other areas of the country and the world are experiencing incredible heat stress. Today, we're going to focus on another area of climate change-related health consequences, which are vector-borne disease and illness. I'll specifically have a major focus on Lyme disease because that's endemic, very common in the northeastern United States. And the scope of Lyme disease is growing in the country. I'll touch upon other vector-borne diseases as well, but Lyme disease will be one of the major foci. So summer is here. Last week, as I shared with you, Suellen Breakey talked about heat-related illness, which is a major area of concern with our climate-changing world. But we also have other concerns. So, for example, I mentioned Lyme disease is exceedingly common in the Northeast. The causes, recognition, interventions, and prevention of vector-borne illnesses are incredibly important, and particularly Lyme disease and also chronic Lyme disease is a major problem. And for those of us in the MGH family, whether we're providers or patients or families, Spalding Rehabilitation Hospital actually has a premier chronic Lyme disease center. It's worldwide renowned for addressing chronic consequences of Lyme disease. I'm just trying to advance my slide, sorry. There we go. So climate change is affecting vector-borne disease, and in the medical and nursing and health professions literature, it's abbreviated as VBD. We also call it vector-borne illness. And climate change affects vector-borne diseases through several mechanisms, and the impacts vary from various parts of the country. But here in the Northeast, as I shared, Lyme disease is incredibly common. It was named because it was first diagnosed in Lyme, Connecticut, a town in Connecticut. And the current evidence suggests impacts on some diseases may already be occurring. So what that means is that Lyme disease, and when Lyme disease affects people, is increasingly common earlier in the year because the temperatures are warming, and later in the fall seasons as well. So what is a vector-borne disease? These are diseases that are spread by arthropods or small animal vectors. In the case of Lyme disease, it's a tick-borne illness, and vectors act as the main mode of transmission of infection from one host to another, and are an essential stage in how the disease is spread. So what many of you may know is that because the deer population has become increasingly common and has grown very, very widely in the Northeast, deer ticks have increasingly infected humans and also pets. So for example, dogs and cats and squirrels and other animals can be infected by tick-borne illnesses. So the types of vector-borne disease, there's human vector to human, which are known as anthropogenic infections in the medical and nursing literature. So examples of those types of infections are malaria, dengue fever, and yellow fever, which are not very common in the Northeast. And then animal to vector to human diseases or infections, which are known as zoonotic infections. Lyme disease is an example, hantaviral disease, and West Nile virus, which is spread by mosquitoes. I'll share an anecdote. At one point, Dr. Breakey and I were presenting to our faculty colleagues at the MGH Institute of Health Professions, and one of our faculty colleagues said, "I never realized how pervasive climate change related infections and diseases were." And the person shared that one of his children has asthma, which is exacerbated by greenhouse gas emissions and carbon emissions from automobiles. And his other child had a pediatric intensive care unit visit experience because of West Nile virus. So it's important for people to be aware that in a climate changing world, all kinds of infections are becoming increasingly common. And in fact, COVID-19 is even more common in a climate changing world because of human encroachment or humans moving into areas where animals previously had their habitat or lived. And so that's important to know, that emerging pandemics are also increasing in a climate changing world. So the type of transmission of a vector-borne disease has implications on how to control the spread of a disease. So anthropogenic infections can be eradicated or eliminated if all human cases are treated. And zoonotic diseases are much more difficult to control, since all animal reservoirs of the disease would need to be treated. And what that means is, for example, deer carry ticks that carry Lyme disease. Zoonotic disease that's carried by deer would have to be eradicated or eliminated with all of the deer who carry Lyme disease, who are infected by ticks with Lyme disease, would need to be treated or eliminated. And that's a very difficult problem, as you can well imagine. Deer have become increasingly common in the Northeast. there's been some discussion in the popular press about limiting deer prevalence, the deer population in the Northeast, but it's an incredibly complex problem to address. So vector-borne disease dynamics. So what does it mean to have a vector-borne disease? There's a susceptible population, which are humans. There's a pathogen, which is the Borrelia burgdorferi bacteria, which is what transmits Lyme disease. And there are other bacteria that transmit other vector-borne illnesses, whether it's malaria or dengue fever or hantavirus. But there's a pathogen that has a mechanism for survival, for transmission, and for replication in the host, which is a human. And then the vector itself has to have the ability to survive and have a lifespan. It also has reproduction and breeding patterns, which include warm temperatures, temperatures with a lot of humidity, and then the biting behavior. So for malaria, the vector is a mosquito, and for West Nile virus, and for tick-borne illnesses like Lyme disease, it's a tick. So there are direct effects of climate change on vector-borne illness. So climate change has the potential to increase the range or the abundance of animal reservoirs such as ticks and arthropod vectors. So for example, malaria, schistosomiasis, Lyme, and also enhance the transmission. So in wet and warm climates, West Nile virus can be transmitted much more rapidly. There's also an increase in the importation or how vectors spread more commonly in more common language. For example, dengue, chikungunya was common in the Caribbean and then moved to Florida and some of the southern states, and was very common in South America, particularly Brazil. And chikungunya can actually cause severe prenatal and postnatal complications like brain complications in fetal development and after a baby is born. So it has had lots of consequences, particularly in the country of Brazil. And then West Nile has become endemic in the northeastern US. There's also an increased animal disease risk and potential human risk with certain other climate change related vector-borne illnesses. So why are vector-borne diseases increasing? There are temperature effects on vectors and pathogens. So there's survival increase depending on the species in the Northeast United States because of longer seasons where the vectors can survive earlier in the season and later in the season. There are also changes in the susceptibility of vectors to some pathogens. So for example, the deer population is surviving longer and carries tick-borne illnesses such as Lyme disease. There are changes in the rate of vector population growth, specifically deer in the Northeast, and then changes in the feeding rate and the host contact. So the ticks are actually surviving longer in a climate changing world related to their feeding behaviors and their contact with, for example, deer. There are also increases in humidity and heavy rainfall. So for example, the Northeast is in the midst of a drought right now, but the past few years we've had a lot more moisture in the form of rainfall, which also increases vectors in the environment. And there's also an increase in activity that increases transmission rates related to more humidity and more rainfall. Again, I'll say this past year has been an anomaly. The Northeast United States because of climate change, has been getting more rainfall, whereas other areas of the country get far less and have droughts. But the Northeast, except for this year, has had more rainfall, which increases vectors. And I also want to mention that Zika is the virus that actually has infected fetuses and children and caused brain damage. Chikungunya is another vector-borne illness that has caused a lot of challenges, particularly in the southeastern United States. I'm just going to, so now I'll move on to Lyme disease, which is the most commonly reported vector-borne illness in the United States, and particularly the northeastern United States. You can see my slides now, can you, Suellen?
Yes.
Okay, great. There are an estimated 300,000 infections occurring each year, and it's exceedingly common in the greater Boston area and areas surrounding the MGH community. And it's caused by a bacterium called Borrelia burgdorferi, and sometimes other bacteria, another variation of the Borrelia bacterium. And it's transmitted to humans through the bite of infected black-legged ticks. So this is a map showing the marked increase in Lyme disease incidence in the past 2 decades. You can see that previously it was in the Pennsylvania, New Jersey, Connecticut, New York, Massachusetts area, extending up into Maine, but now it's become very, very common, more widely in the United States. This is from 2018. And because of temperature change related to climate change, there are major shifts in the geographical distribution of ticks that carry Lyme disease. So what should you know as a patient or a family member of someone who has Mass General as their provider? These are the signs and symptoms of early Lyme disease. And there is a characteristic skin rash, and it's called erythema migrans by healthcare providers. Often people have fatigue, they have chills and a fever, they have headache, they may have muscle and joint pain, and they may have swollen lymph nodes in the armpits, in the groin particularly. And that's because the infection has actually caused their immune system to become activated. So swollen lymph nodes are extremely common. So for treatment, early diagnosis and proper antibiotic treatment of Lyme disease can help to prevent late Lyme disease. Although Lyme disease is rarely life-threatening, delayed treatment can result in more severe disease. And people who notice a characteristic rash or other possible symptoms should consult their healthcare providers. And actually, we had a clinical and case study article published in the Journal of the American Association of Nurse Practitioners on the nurse practitioner's role in addressing chronic sequelae of Lyme disease, chronic complications of Lyme disease as a climate change related disease. And unfortunately, people may not always get the rash that goes along with Lyme disease. So on this slide, you'll see signs and symptoms of Lyme disease. I mentioned that healthcare providers call the rash erythema migrans. And it's a reddish or purple colored rash that usually appears 3 to 14 days after the bite of an infected tick. And further along, I'll show you photos. So that for those of you who are patients and family members of those in our MGH family, you'll be able to see what erythema migrans looks like so that you can recognize it. The rash typically appears at the site of a tick bite, and it tends to be round or oval, and it expands gradually over the course of several days. The common sites are the thighs, the groin, the trunk, and the armpits. So that's where the ticks tend to migrate, to those warm, moist areas of the human body. The center of the rash may clear as it enlarges, and it eventually results in what we call a bullseye appearance. And again, I'll show you photos further along. But this is not always the case. The rash may be warm, but it's usually not painful. Some patients with early Lyme disease do not have or even notice any rash, but instead they may just have flu-like symptoms. So they might have fever, fatigue, muscle aches, and not all rashes that occur at the site of a tick bite are due to Lyme disease. So some ticks spread infection, but it might not be Lyme disease, which is why it's really important to connect with your healthcare provider if you see a rash that you think may be Lyme disease. There can be an allergic reaction to tick saliva that can be confused with an erythema migrans rash. And allergic reactions to tick saliva usually appear within a few hours after the tick bite, but usually do not expand, and they disappear within a few days. So you, as your own healthcare provider, need to be aware that if you live in marshy areas, if you live in areas with trees, a lot of open areas, perhaps you walk a pet, a dog, for example, in a forest area, you have to be very vigilant about looking for a rash, looking for ticks, and communicating with your healthcare provider. So here's an example of what the Lyme erythema migrans rash would look like. And I've included both a person of white background and also a person of color, because a rash doesn't always look the same for a person of color. And that's particularly important for those of you from the MGH family who may have Black skin or brown skin and come from BIPOC populations, that the rash may look very different. And it's important for all of you to be aware of that. You can see that in the white person, the redness of the rash is more prominent, but in a person with Black or brown skin, the rash may look very different. And it isn't a bullseye rash, quote unquote, which is what we often talk about. So you should seek medical attention for the following: a rash, a fever, exhaustion, joint or muscle aches within weeks of removing a tick or being in a high tick area. And it's also important that if you remove a tick from your body, that you put it in, for example, a glass jar, and you bring it to your healthcare provider, if possible. So this is a look at Lyme disease rashes. And there can be faint colors and borders. There can be crusted centers. There can be more than one rash. So it doesn't have to be a typical reddened rash, a bullseye rash. It can be more than one rash. There can be different shapes and colors, and they can appear anywhere on the body. You can see that the person with Black or brown skin on the third level down has a rash that appears on the left knee that almost looks like a bruise rather than a tick-borne rash. So it's very important to be alert whether one has white skin or Black or brown skin. You can see the notation. Most people with Lyme disease develop an erythema migrans rash at the site of the tick bite. The rash usually expands slowly over several days, reaching up to 12 inches or more across. However, not all rashes are a sign of Lyme disease. The redness in the picture to the left is caused by irritation by the tick bite, not a tick-borne infection. Again, I'll emphasize that's why you should reach out to your healthcare provider and be seen in clinic. So a little bit about chronic Lyme disease. So late Lyme disease is a tremendous problem. It can cause all kinds of chronic health issues. As I mentioned, Spalding Rehabilitation Hospital has a world-renowned chronic Lyme disease clinic. And chronic Lyme disease is also known as, I'm going to look at the article that talks about it, post-treatment Lyme disease syndrome. So there's actually a syndrome that occurs with chronic complications of Lyme disease that's undertreated. Some signs and symptoms may not appear until weeks or months after a tick bite, and people may not have the rash that the erythema migrans rash that's predominant in white people and less common in people with black or brown skin. What occurs then is generally arthritis, which is most likely to appear as brief bouts of pain and swelling, and usually in one or more large joints, particularly the knees. So if you live in an area that's heavily forested, for example, if you walk a pet or you take trips through the forest or areas where ticks may be common, you should be very, very aware that even if you don't get a Lyme disease rash, that if you have pain and swelling in the knees in particular, you may actually have Lyme disease that has not been treated appropriately because you haven't had a diagnosis. There can also be nervous system symptoms, such as numbness in the extremities, like the feet in particular, or the hands. There can be pain. There can also be nerve paralysis. So, for example, the facial muscles, usually on one side, and there can also be severe consequences like meningitis, which is a swelling of the brain and the spinal column that includes fever, a stiff neck, and severe headache, and that's a medical emergency. There can also rarely be irregularities of the heart rhythm, so there can be heart complications, and there can be problems with memory or concentration. Fatigue, headache, and sleep disturbances can also continue after treatment. And prompt treatment of early Lyme disease can avoid complications. So how is Lyme disease, early Lyme disease, treated? With antibiotics. So antibiotics such as doxycycline or amoxicillin, and you don't need to remember those as patients or family members, but providers would be well aware of treating you with antibiotics to prevent complications of Lyme disease, whether it's early or late Lyme disease. So late Lyme disease often requires longer-term antibiotic treatment for a month or longer. So the other thing that's important to know is that you can be reinfected with Lyme disease. So it is not a disease where you can get it once and never get it again. You can be reinfected. If you have a dog that you walk in a wooded area, you may well know that dogs can be infected and reinfected. And we know that veterinarians are very well apprised about Lyme disease in animals and tick-borne illnesses in animals, and checking your animals as well as yourself for ticks is incredibly important. So you can get Lyme disease again if you're bitten by another infected tick. So protect yourself from tick bites. So here's a view on a person of white background of the erythema migrans or the bullseye rash. Lyme arthritis, the swollen knee, can occur, very, very common in untreated Lyme disease. There can also be a facial palsy, which is commonly known for patients and families as a facial droop. And that is a very common complication of Lyme disease. Excuse me. So healthcare providers should consider the following factors when diagnosing Lyme disease: the history of possible exposure to ticks in areas where Lyme disease is known to occur, the signs and symptoms suggestive of the illness, and I mentioned what you might present to your healthcare provider with: rash, fever, swollen lymph nodes. And then they can take blood tests that can help to diagnose Lyme disease as well. So how to assess for Lyme disease? Where should you check for ticks? You should look in and around your ears, in and around your hairline. So you might need a partner or a family member to look in your hair. If you have, for example, a pet that you walk in the woods, you would want someone to check when you come back. In the hairline, under the arms is important, inside the belly button. So again, that's an area that could be moist, and around the waist, because someone's shirt and pants may lift up and then ticks find their way there, between the legs and the back of the knees. It's important to note that there is no vaccine for Lyme disease that's currently available. It's also why veterinarians are incredibly alert to assessing pets for Lyme disease. There is a blood test that can check for Lyme disease, and that's incredibly important for pets and humans. So another thing to think about: where do you live? You can also have landscaping to create tick-safe zones. So black-legged ticks need high humidity to survive. They die quickly in drier environments and when they're not on a host, like a deer. So removing leaf litter and clearing tall grass and brush around your house is important. And at the edges of the lawn, that will help reduce the number of ticks. Placing wood chips or gravel between lawns or play areas and wooded areas can create a dry barrier that is difficult for ticks to cross. And fences can help keep deer away from your homes. So number one is a tick zone. Avoid areas with forest and brush where deer, rodents, and ticks are common. So my family lived very close to a beautiful wooded park and would walk our dog in that area. And the dog was repeatedly infected with Lyme disease. Using Lyme disease medications on animals and also permethrin medications or over-the-counter tick reducing products on the skin are important. And I'll talk about that a little bit further along. But avoiding areas with forest and brush are really important. Or using tick medications, for example, on pets when you walk them in wooded areas where deer, rodents, and ticks are common is important. But number two is the wood chip barrier. Use a 3-foot barrier of wood chips or rock to separate the tick zone and rock walls from the lawn. The third is a wood pile. Keep wood piles on the wood chip barrier away from the home. Have a tick migration zone, so maintain a 9-foot barrier of lawn between the wood chips and areas such as patios, gardens, and play sets. The 5th tick safe zone is to enjoy daily living activities such as gardening and outdoor play inside the perimeter. And for gardens, plant deer-resistant crops. So if desired, an 8-foot fence can keep deer out of the yard. So this is for people who live outside the city, who primarily live in wooded areas. But it's important to note that if you live in the city, squirrels, for example, can carry ticks and infect people. And anytime you have any kind of recreation where ticks and other deer, rodents may be common, it's important to be vigilant about looking for ticks on one's body. And then play sets, keep play sets in the tick safe zone in sunny areas where ticks have difficulty surviving. So mitigating or limiting climate-related risks of tick-borne illness. So healthcare providers are really instrumental in educating patients and families on the links between climate change-driven increases in temperature and expansion or further rollout of tick-borne diseases like Lyme disease. So at your primary care visit, particularly if you live near a wooded area, maybe you have a pet that requires walking in a wooded area, have a conversation with your healthcare provider about the fact that climate change is really driving an increase in tick-borne illnesses. Preventive measures that you should think about include use of permethrin or Environmental Protection Agency registered tick repellents. These are available widely over the counter at pharmacies. And these are really important for whether you're going on a walk through a wooded area, whether you regularly walk with a pet or hike on trails. When you're in wooded areas, you should recognize that it's important to tuck your pants into your socks, not wear shorts, and avoid and tuck your sleeves into gloves and wear gloves if possible, and avoid contact with brush in wooded areas. You also want to regularly perform tick checks on equipment, on pets, and yourself after spending time in wooded or grassy environments. So preventing tick-borne illness, it's Lyme time. Protect yourself. And this poster in particular is incredibly helpful for patient and family education. I went over the slide on the right-hand side of the slide, the areas where you should pay particular attention. And on the left-hand side, how to protect yourself against Lyme disease. Walk in the middle of trails, avoid sitting on logs and leaning on trees. Wear a hat and tuck in your hair if possible, because ticks can be attracted by hair. Wear a long-sleeved shirt fitted at the wrist. Wear shoes and not bare feet or sandals. Wear long pants tucked into high socks or duct tape around the pants. Consider DEET for skin and permethrin for clothes, incredibly important. Wear white or light-colored clothing so it's easier for you to see ticks. And then do tick checks immediately and 3 days after outdoor activity. If you find a tick, remove it carefully and save it. As I mentioned, put it in a glass jar to bring to your healthcare provider for a conversation about whether or not you've been exposed to Lyme disease. And also ask your veterinarian about protection for your furry friends. If the tick attaches to your skin, remove it with tweezers. Pull it straight out as close to the skin as possible and save it in a container and call your healthcare provider. So prevention, you can see on the right-hand side of the slide, the black-legged tick or deer tick and an enlarged view. So the larva is depicted and the nymph, the adult male and the adult female. And then there's an enlarged view at the bottom for the American dog tick or wood tick. And you can see, most importantly, the engorged adult that has both infected a person or a pet with the bacterium and absorbed blood at the same time. So for prevention, you want to think about using insect repellent when going outdoors. Deep picaridin and oil of lemon eucalyptus is also incredibly effective, as well as some of these other products. But oil of lemon eucalyptus is a climate friendly and also not something that you could think about using on children to avoid exposure to other products. Also wear clothing treated with permethrin, so the clothing really avoids having a tick attached to the human body or be on the clothing. When you get back, particularly from wooded areas, shower as soon as possible and perform daily tick checks with particular attention to the armpits, behind the knees, the hair, and the groin. And you can also put clothes in a hot dryer for 10 minutes, which will destroy any ticks. So I'll stop there and open it up for questions from patients, families, healthcare providers. Thank you.
Thank you so much, Dr. Nicholas, for an extremely helpful presentation. We are now towards the end of the session, so if you have any questions, feel free to enter them in the chat box. You had mentioned earlier in your presentation an example being plant deer-resistant crops. What are some examples of plant deer-resistant crops?
So that's a great question, Amy, and I'm not sure I have a full answer for that. I think keeping grass closely cropped is one example, whatever type of grass one grows. But while we're thinking about
I pulled up some examples.
Thank you, Suellen.
Bayberry, so deciduous shrubs, for example, bayberry, beauty bush, bottle brush, buckeye, boxwood, which is common, witch hazel, dogwood, forsythia are some examples. There's some deciduous trees, sycamore, beech, birch. There's a big list. Japanese flowering cherry trees, pine, spruce, juniper, and there's also a list of plants, crocus, daffodil, iris, Dutch iris, hyacinth, marigolds, and nasturtiums, and sweet alyssum. So those are pretty commonly used plants. And then perennials include bleeding heart, purple coneflower, daylilies, which we see a lot of, coreopsis, foxglove, lavender, another one, lily of the valley. So there's I think there's a whole list out there you can find on the internet, and then you could plant accordingly based on your, shade and sun, etc.
Sure. And to clarify, these are plants that deers generally don't like to go towards. So how about plants that tend to attract deers? Are there any such plants?
Well,
off the top of your head?
Off the top of my head, I don't know. Except I do know they often, I'm going to look that up because they do like to eat things and they come close to.
And I just looked, Suellen, it says red clover, chicory, orchard grass, and certain high protein crops such as peas, soybeans, turnips, alfalfa, kale, corn also attract deer. And
so, berries.
And berries, yes. Yes.
Thank you.
And Amy, it's so interesting because I used to live near the Blue Hills area. There was a huge growth in the deer population there. And that's a wild area, so it's not a crop area per se, but there are lots and lots of cases of Lyme disease because of deer, the growth in the deer population and deer ticks. And it almost doesn't matter what types of crops, because it's an environment that is beautiful, but also sort of a wild environment where the deer just proliferate.
I mean, you mentioned Blue Hills. I know like there are a number of trails that families like to go on hikes.
Yes.
The repellents that you had suggested, are they safe to use on kids?
So they are deemed safe to use on children. The over-the-counter ones are, but I also think it's important to emphasize that the oil of lemon eucalyptus is a repellent that would be absolutely safe on children.
Okay. And what are your thoughts on, you had suggested, you gave a technique on how to properly remove a tick using tweezers. There are many products out there that advertise as tick removal kits. What are your thoughts on those? Do you find those effective?
So I think using one's own tweezers that many people have readily available in their homes is just as effective. And pulling the tick off of the skin and getting it in a glass bottle to be able to bring to one's healthcare provider, because there are also ticks that are not the black-legged ticks that carry the Borrelia bacterium, and a healthcare provider could look and then say, oh, you don't need to worry about that. A veterinarian could do the same thing and say, you don't need to worry about that. But the issue about reinfection, Amy, is something really important, because it's not like, it's almost more like COVID-19, where you can get reinfected and reinfected over and over again. It isn't like when I was a child, there wasn't a measles vaccine or a chickenpox vaccine where if you got infected, you had lifelong protection against it. It's something that you can get over and over again. So for families in particular who live in tick-laden environments where ticks are very common, it's a big challenge for sure. And then, as I mentioned, for those with black or brown skin, the rash itself isn't even necessarily very clearly identifiable. So, and then if you live in the city, squirrels, for example, can carry ticks. And I live in the city, and it's, we had a pet, a dog that we no longer, that brought us great joy and we no longer have. But the veterinarian was very clear that squirrels could cause tick-borne illness in our pet. So it's, and then it can also then be transmitted to people. So it's important to know about that, and that the rash is not characteristic in people with variations in skin color.
So how about with animals? I know for humans, we can check for rashes as a sign. How about animals?
It's very difficult, Amy. I'm so glad you brought that up, because many animals are hairy animals, so you wouldn't necessarily see it. It is possible that you would see a bullseye rash, for example, in the undercarriage of a pet. So, for example, a dog might get a bullseye type of rash in the undercarriage, but it's really important to stay connected with one's veterinarian to test regularly, particularly if you live in a tick-infested area, because either the hair of the animal's body or a complete absence of a rash may occur.
Sure. Are there currently any research being done to hopefully offer vaccine in the near future?
Yes, great question, Amy. There is a lot of research ongoing. In our climate changing world, where we know that vector-borne diseases and illnesses, and particularly Lyme disease, is a huge problem, and chronic Lyme disease creates all kinds of incredible problems. So, for example, at Spalding Rehabilitation Hospital, they are doing research on chronic Lyme disease, and the fact that there is depression and neurological consequences that can go along with untreated Lyme disease and chronic Lyme disease. So I think Germany also has a center, but we need to be doing much more work on chronic Lyme disease, but they are doing great work at the National Institutes of Health on Lyme disease, a vaccine, and addressing the challenges that Lyme disease and other vector-borne illnesses lead to in a climate-changing world.
Mm-hmm. Are there any online resources if anyone's interested in learning more about vector-borne diseases?
Great question too, Amy. The Centers for Disease Control and Prevention has fantastic resources. And I'm just going to see if I can paste those into the chat.
Sure, thank you.
They have a whole division on vector-borne diseases. And the CDC, when we think about our federal government and what our taxes pay for, it is incredible that we have the Centers for Disease Control and Prevention. They are a gold mine. And we know that during COVID-19, they were challenged, just as we all were, with an emerging pandemic. But they are really impressive in the resources that are very patient and family focused. They are really amazing in offering resources that patients and families can read in regular language, not healthcare provider language, but regular language. So please do review the resources that we've posted. Thanks, Suellen, also for posting.
Thank you. So it looks like we have about a minute left while we wait to see if there are any final questions. Do you have any final thoughts you'd like to share with the audience?
Well, we're going to take a hiatus from the Climate and Health series in August, but we'll be presenting on mental health consequences of climate change, which are very poorly understood by patients and families. Depression, anxiety, suicide and suicidal ideation, particularly among farmers and farm workers, migrant populations as well. And also there are new concepts known as eco-anxiety and solastalgia, which are mental health consequences of climate change, Amy and colleagues. So please stay tuned for our September presentation.
Thank you so much. And if you're not already on our email list, our Blum Center email list, feel free to email us at pflc@partners.org, and we'd be happy to add you to our email list. This gives you access to our monthly emails, where we'll then keep you up to date on upcoming programs, including this one in September.
Amy and everyone in the audience, thank you so much for welcoming us to talk about the important health consequences and adverse health consequences of climate change.
Thank you so much for taking the time to spend us and give all this health information. Dr. Breakey, thank you for joining us today as well. Thank you for providing all the resources in the chat. And as I mentioned, today's session is being recorded. So if you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Thank you so much, everyone. Have a lovely rest of the day.